Good morning, Good Life family. This is Dr. Jake Tucker. We're coming to you live on Facebook, and if you're in the office, welcome to another episode of MaxLiving Radio. We're recording today with Dale, and we're going to be talking about the latest issue of Consumer Reports magazine. We were talking before the episode started airing, and we think it's no coincidence that Time magazine came out with their opioid crisis episode just a few weeks before this episode of Consumer Reports came out. We think that probably they spaced it out so that you wouldn't see, oh, the number one issue is the drugs are killing us. No, the number one issue is your drugs are too expensive. And so we're going to dive into that a little bit, but Dale's going to give us the countdown first.
Here we go. Good morning, Good Life family. Take two.
Take two.
Facebook family.
We're taking two.
Good morning, Good Life family. Thanks for joining us here on KFOR FM 103.3, 1240 AM. Hope you're living well today. Every Saturday morning at this same time, Dr. Jake Tucker is here from Good Life Family Chiropractic on MaxLiving Radio. Dr. Jake, good to have you here.
Good morning, Dale. How's it going?
You're going very well, and you bring with you a Consumer Report magazine. First of all, didn't even know those still existed.
Yeah.
Number two, they're a lot thinner than they were when I was reading them on a regular basis. But we're not talking about the best grill to buy, the best car to buy, the review of the latest blender in your kitchen. This is a serious subject, and it warrants, according to the Consumer Reports staff, the front page cover. Pay less for your meds.
Yeah, it's a big issue, really, and not from a thick perspective, but because they're trying to address the healthcare crisis from a very medical approach. And when you talk about medicine is the study of disease and what makes you sick. But that's not what we're interested in, because that's not health. You know, it works in an emergency. It works in an emergency room, but it doesn't work for keeping us healthy. And when you look at our healthcare crisis, the problem isn't that we don't have enough medical coverage. It is that we are sick, suffering, and dying because we don't know what health is. And you look at, just Time magazine, just two issues ago, was all about the opioid epidemic. Opioids are killing us at a rate of 64,000 deaths per year and climbing. I mean, that number was astronomically lower than that in the early 2000s and has climbed to be one of the top causes of death, top 10 causes of death in the United States. But here's an even more troubling statistic, and this is on page 5, the first article in the issue, and it's talking about keeping hospital patients safer. And what they're saying is that an estimated 8.8 million hospital patients suffer from preventable harm each year, and as many as 440,000 patients die in hospitals after a medical error or hospital-acquired infection. Now, if you've listened to the show, you've heard me quote statistics on the number of deaths that happen from the top causes of death every single year. And 50% of all deaths happen from heart disease and cancer. 600,000, plus or minus a few thousand, depending on what you're linking that in with, people every year die from heart disease. 500,000 people every year, plus or minus, die from cancer. 440,000 due to hospital error, acquired infection, puts that at number 3, and that's just errors. That's not the deaths from you responding to them doing the right thing. And it comes down to this, because it's not the hospital's fault, because we don't even go to the hospital until we're sick. We're not accessing health from the health side. We're not using that ounce of prevention is worth a pound of cure. What we're doing is we're waiting till we're sick, because what happens with health? Health is 100% optimal function. Unfortunately, you don't get your first symptoms until you start to experience years of malfunction. It's about 60% function is where that first symptom starts to show up. And so you're living your lifestyle, you're eating bad food, you're getting exposed to these toxic pesticides and chemicals and heavy metals, you're not exercising, you're sitting on the couch, you're having poor posture in front of your computer, you're sitting at a computer desk every single day, and all of these things, they decrease function. And by the time you get a symptom, now you're like, okay, well, give me an over-the-counter med. Okay, well, now go to my doctor and we'll see what he can do. And by that point, you're too late, because even at that point, all they're attempting to do is just cover up the symptom with a medication. The medications aren't designed to cure you. They're just designed to come in and intervene in a crisis. No medication is designed for you to be on it long term. I mean, even the diabetes meds are just designed for crises, really. And when we look at the long-term outcomes of taking medication, you get sicker and sicker. And so for this magazine, this Consumer Reports magazine, to talk about, we need to come up with a cheaper way for you to get your medications because so many people are having to choose between their medication and food. We're coming at it from the wrong end. When you look at the national reports on this, what they say is that our country performs so much worse compared to all the other countries in the world, not because we don't have enough meds and not because our meds are too expensive. We take 74% of the world's prescription medication is just 5% of the world's population. That's not the problem. The problem isn't that we don't have enough meds. It's not that we don't have enough access to meds. It's not that we don't have enough insurance coverage for our meds. The problem is that in our system, we rely on our symptoms so much for our health that we actually completely miss the boat on what health is. Because health is not feeling good. And so when we're talking about this Living with Longevity, the Forever Young workshop that we're doing this Monday night at 6:15 in my office, that's at 56th and Pine Lake, Good Life Family Chiropractic. It's a $25 workshop. And so because we're within just a couple days of this workshop, if you want a ticket for that, I'm going to set aside 3 at a 50% discount. We'll do them for $10 a piece for just the first 3 callers today at 402-413-8825. Leave a message. We'll get a text message or a phone call back to you by Monday morning confirming you for that seat. And then you can come and you can learn about the causes of all the things that are taking our lives so much earlier than all the other industrialized nations. Why all this money that we're spending on? And that's the way that we address problems in the United States, right? If there's a problem, we throw money at it. And we're spending more money than any other healthcare system in the world, and it's not working. We're the worst when it comes to overall health. We're the worst when it comes to longevity. We have the fewest amount of blue zone regions where people are surviving to the age of 100 than any other industrialized nation in the world, and it's because we don't know what health is. And so what is health? Health is 100% optimal function. And there's one system, that controls function in your body, and that's your nervous system. I mean, just for your heart to beat, for your lungs to breathe, for a cut on your leg to heal, that information has to flow from the brain down the spinal cord and out those nerves to every organ, cell, and tissue. And so if you're following along right now, some of you might even be taking notes. I want you to write down pressure, and then the numbers 1, 2, 3. And the first number is brainstem. The second number is spinal cord, and the third number is nerve roots. And just think to yourselves right now, which of those, if there's pressure on one of those 3 areas, which one of those is the worst?
Give me the options again.
It's brainstem, spinal cord, or nerve roots. And now don't get me wrong. Don't get me wrong. All of these are important because if you've got pressure on the nerve that goes to your heart and it's creating malfunction and disease in your heart, that's a very important area. But brainstem is by far the most important.
That would have been my guess.
Yeah.
Anything to do with the brain.
Yeah, absolutely. If you interfere with the brain, you're starting to create problems. But if you have pressure on that, and so, what is it that protects that? Because all it takes is the weight of a dime to disrupt signals going through there. So we want to surround and protect that system that's susceptible to the weight of a dime with the hardest substance in the body. And what that is bone. The same length in steel of bone is actually stronger than steel. And so touch right under the base of your skull. The base of your skull, at the side of your neck, right behind your earlobe. There's a little bony part that sticks right out underneath there. Mm-hmm. Say the word Atlas with me.
Atlas.
Atlas. And everybody knows the Greek god Atlas that held up the world on his shoulders. That top bone holds your head up, but more importantly, it surrounds and protects the brainstem. If that's off even 2 millimeters or 2 degrees, that can put the weight of a dime on your brainstem. And here's the thing, is we have research that went in and studied several hundred newborn babies. And what we found is 95% of them had an Atlas misalignment in their spine, putting pressure on their brainstem. Do you think that baby has any chance of surviving and growing up to be a healthy baby No, and you wonder why our kids are so sick. And a lot of it comes down to these interventions and this interventionist mindset that we have when it comes to healthcare. But so much of it is just the normal birth process. I mean, you think about if you've watched a birth, that baby's head just doesn't pop straight out. You know, if there wasn't the use of forceps, if there wasn't the use of vacuum extraction, and if there wasn't a C-section, just a normal birth, that baby's head comes out and then it turns to the side and then it turns to the other side while it's being helped out by the doctor. And in the case of my daughter, the doctor helped out by pushing down and pulling up and pushing down. And then when they handed us the baby, they said, careful with the neck. Because as a chiropractor, I needed to be taught to be careful with the neck. But as a parent, sometimes it's important to understand that. And so if you're sitting here and you're like, oh my goodness, I've never been checked. I've never had my spine checked. What we're going to do after the break is we're going to talk a little bit about what that looks like to get the spine checked, but what we're talking about is really the most priceless information in the world when it comes to your health, but when it pertains to your life and the quality of your life, that right there is where the money is. And so right now I'm going to open up the offer. We're going to do for the first 4 callers a 50% discount off of the necessary exam and x-rays that would take in order to get your nervous system checked adequately. And so normally that'd be $130, so today we're going to do that for $65. And that's going to include everything. The 4-point neurological evaluation that I'm going over the break, and any necessary x-rays. So 402-413-8825, and we're going to go over what that 4-point evaluation consists of, as well as why it's even necessary to take the x-rays in the first place.
So stay right where you are. We're coming back with Max Living Radio in a moment.
All right, Facebook, you got it. You're going to have to tune in Saturday if you want to catch what that 4-point evaluation looks like. If you've had that done, you know the value of it. Send your friends, send your family to the radio show, to Facebook, to the Facebook page, Ask Dr. J, Good Life Family Chiropractic, and you'll get the rest of the show. Have a great day, guys.